and Assalamualaikum sir. Today I and my group mates from group 5 will present about our drug which is meperamine, metronidazole and pyrimethamine. Explanation of the AFIQ name of meperamine. For N4-methoxybenzyl, it is because the molecule has a benzene ring with a methoxy group at the para position attached to a benzene group. For an N-dimethyl, because it has two methyl groups that are attached to the terminal nitrogen atom of the ethylene diamine chain. For N2-pyridyl, because it has pyridine ring that is attached to the other nitrogen atom of the ethylene diamine at the 2 position of the pyridine ring. And for ethene 1,2-diamine, because the backbone of the structure is a 2-carbon ethane chain with amine groups attached to both carbon atoms. The alternative name for meperamine is pyrilamine. For the medicinal use of meperamine, meperamine is an antihistamine. Meperamine can be used as symptomatic treatment for allergy, to treat the hypersensitivity reactions and pruritic skin disorders. Next, for the interaction with human, meperamine is an antihistamine with antipruritic, sedative and local analgesic properties. The mechanism of action is it blocks the binding of histamine on his receptor sites, so it will inhibit the effect of histamine in the body. Histamine is a signaling molecule that released by mast cells when immune system is overreact with allergen, and will cause physical changes to the body in order to fight against the allergen. Next, for the side effect of meperamine is burning skin and rashes. The synthesis of meperamine involves 3 processes. First is formation of the intermediate. Second is introduction of the ethylene spacer, and last step is formation of meperamine. For the first step, a condensation reaction occurs between the aldehyde group of methoxybenzaldehyde and amine group of 2-aminopyridine, leading to the formation of a shift-based intermediate, and the result is molecule contain both aromatic ring of methoxybenzaldehyde and the pyridine ring of 2-aminopyridine connected through a single bond. For the second step, the secondary amine in the shift base attack ethylene carbon of chloroethylamine, replace the chloroion and form a new ethylene bridge. And the last step, for the formation of meperamine, the product undergoes alkylation with dimethyl sulfate to introduce the dimethylamine group, then completing the meperamine structure.
I'm Nisyya. I will be discussing about metronidazole, a widely used medication with significant applications in the medical field. Let's dive into its chemical structure, synthesis, medicinal uses, and human interactions. First, let's look at the chemical structure and the formula of metronidazole. Its chemical formula is 6,6H9N3O3, and it is composed of an imidazole ring, which serves as the core of the structure. A nitro group at the 5th position, crucial for its antimicrobial activity, a methyl group attached at the 2nd position, and an ethanol side chain linked to the nitrogen atom of the imidazole ring. This unique structure allows metronidazole to disrupt the DNA of an aerobic microorganism, making it an effective treatment option. Metronidazole is available under various brand names, including Flagyl, a common brand for oral and intravenous forms, Vaginal and Ziomed, which are often used as topical gels, and AKIA, another topical formulation. This alternative make metronidazole accessible for different forms of treatment. Next, I will break down the process into 3 simple steps to understand how this important compound is formed. The synthesis begins with the imidazole formation. Lyocell, ammonia, and acetaldehyde undergo cyclization reaction to form methylimidazole. This step is the foundation for building the imidazole ring structure, which is central to metronidazole. In step 2, methylimidazole is nitrated using nitric acid and sulfuric acid. This reaction introduces a nitro group at position 5 of the imidazole ring, resulting in 5-nitroimidazole. This nitro group is critical for the antimicrobial activity of metronidazole. Next, in the hydroacetylation step, 5-nitroimidazole reacts with chloroethanol in the presence of sodium hydroxide. This reaction substitutes a hydroacetyl side chain at position N1 of the imidazole ring, forming the final compound. The product of this synthesis is metronidazole, a 1,2-hydroacetyl 2-methyl-5-nitroimidazole. This compound is widely used as an antimicrobial and anti-protozoal agent in medical treatments. Now, we come to the medicinal uses and application. Metronidazole is highly versatile in its medicinal application. It's used for gastrointestinal conditions like bacterial vaginosis. It treats dental infections such as necrotizing gingivitis. It's also effective against protozoal infections like trichomoniasis, and it's used topically for rosacea, targeting redness and inflammations. Metronidazole can be administered through various routes: orally, in the form of tablets or capsules for infections like amoebiasis and gardiasis, topically as a gel or cream for conditions like rosacea, intravenously for severe anaerobic infections, and even as suppositories for patients who cannot swallow pills. Lastly, let's discuss its interaction with humans. While metronidazole is highly effective, it can cause gastrointestinal issues such as nausea, vomiting, or diarrhea, neurological symptoms like dizziness or headache, particularly with prolonged use, and hypersensitivity reactions, including rashes or itching. Special precautions are needed for specific populations. For pregnancy, it is avoided during the first trimester as it crosses the placenta. For breastfeeding mothers, it may pass into breast milk, requiring temporary cesations. And patients with renal or hepatic impairment may need dose adjustment due to the altered drug clearance. It also worth noting the interaction with alcohol, which can trigger a disulfiram-like reaction, and with drugs like warfarin and lithium. That's all from me. Thank you.
Hi, Assalamualaikum. My name is NAJLA KHAIRULAZIM and I will present about the pyrimethamine. So as you guys can see, this is the structure of pyrimethamine and have the nomenclature of 2,4-diamino, 5,4-chlorophenyl, 6-ethylpyrimidine. So this means that there are 2 amino groups attached to the second and 4th carbon of the pyrimidine. And then at the 5th carbon, it has the 4-chlorophenyl attached to it. And lastly, there is an ethyl group which is attached at the 6th carbon of the pyrimidine, so this forms the pyrimethamine. Next, we will move to the synthesis pathway to produce pyrimethamine. So first, 4-chlorobenzicyanate will undergo condensation with methyl ester of propionic acid and happens with the presence of sodium methoxide will produce the beta-ketonitrile. The beta-ketonitrile then react with ethyl autoformate to produce methoxy-methylene derivatives. And lastly, the methoxy derivatives formed from the step 2 will undergo heterocyclization using guanine as the binucleophile and then forms the pyrimethamine. Moving on to the common name and medicinal use, pyrimethamine is known as the name of daraprim, which is an antiparasitic drug used to treat Toxoplasma gondii encephalitis infection or toxoplasmosis. It is usually paired with sulfonamide when treating this infection. And in HIV patients, it is used to treat toxoplasmosis and cystoisosporiasis or isosporiasis, and also can prevent toxoplasmosis and pneumocystis pneumoniae from occurring for the first time and recurring, and also can prevent cystoisosporiasis from recurring in HIV patients. And lastly, pyrimethamine might have some common side effects when consumed, which are nausea, vomiting, and loss of appetite. And some patients also can have serious side effects like swollen or painful tongue, easy bruising, and fever. If any of these side effects happen, patients need to contact their doctor immediately and consult with them regarding the reaction. And that is all from us. Thank you for your time.